Yeah.
Hey, Mr. Canady. Now that we have completed answering all the questions regarding your medical history, I'm going to conduct a physical health assessment at this time, okay? All right. Have you had any changes in your appetite lately?
Mm-mm.
Okay. And any difficulty swallowing? Are you allergic to anything?
No.
Okay. So are you able to swallow thick and thin?
Yes.
Okay. Have you had any abdominal pain, nausea, or vomiting?
No.
Okay. And I was going to ask about, like, bowel movements. Do you have regular bowel movements?
Yes.
Okay. And about how many times a day do you use the bathroom?
About 2.
Okay. You have no, like, abdominal history, any surgeries, appendicitis, your gallbladder, anything like that?
No.
Okay. Sounds good. You don't take any over-the-counter medications at this time. Is that correct?
That's right.
Yes, sir. Can you tell me a little bit about alcohol use? Do you use alcohol at all?
Just a couple of times a month.
Okay. And tobacco. What about tobacco?
I did.
Okay. And how often would you say that how many cans or?
About a can a day.
Okay. And you don't use any recreational drugs?
No.
All right. So just so I can get a better assessment of your nutrition, so what you eat, can you just tell me, like, what you ate in the last 24 hours?
I ate cereal for breakfast,
Okay.
tacos for lunch, and a salad for supper.
All right. Sounds good. You don't have any, like, joint stiffness, pain in your joints, any history of arthritis?
No.
Okay. You have any weakness on either side?
No.
Okay. And you're able to function at home on your own, like you lift and you have full mobility, correct?
Yes.
Okay. And do you do any exercise or, like, heavy lifting?
At work.
Okay. Alright, so now I'm just going to do, I'm going to put some hand sanitizer on. We're going to do, like, a little physical assessment of your stomach. Have you noticed any masses or lumps or anything like that
No.
in your stomach? Okay. Alright, do you have any bruises or anything?
Mm-mm.
Okay, so this time I would just lift up your shirt and I would look for any abrasions, bruises, any skin tears, any wounds at all. I'll also going to palpate for any lumps. Is any of this tender?
No.
Okay. All right. I'd also check the umbilicus and check that it is even midline. Check for any hernias of any type. I'm also going to listen to your bowels just to make sure that you have good bowel sounds.
Okay.
You can just breathe normal. They are hyperactive, so you got plenty of good gurgles in there. Alright, so I'm just going to palpate. At this time, I would palpate the liver and the spleen, just light palpitation. So I would just palpate here, ask you to breathe in deep. Okay. Now I don't feel any, was anything tender? Okay, I don't feel any swelling or anything at all at this time. For rebound tenderness, I would lay the patient down on their back. I would push on one area of the abdomen and ask if it is tender when I pull away. To check for the ascites wave, I would push down midline in the abdomen and tap on one side and feel for a shift or any movement on the other side of the abdomen. So this time I'm going to just check your range of motion in your joints. If you could I'm just going to hold your arm up. Does any of that hurt? Okay. So full range of motion. Just going to check this one as well. Okay. All right, and I'm just going to check your knees. I'm going to check the ankle. And I know you had surgery on this left leg and you had metals, rods, and screws put in. Do you have any pain or problems in this leg?
Mm-mm.
Okay. Alright. If you wouldn't mind standing up, I'm just going to check your hips and your pelvic bones. Make sure that everything is midline. You don't have any back pain. Okay, you can sit back down. Alright, and you've noticed no swelling in your wrist or your ankles at all? Okay. Good. And also no tenderness or swelling in your elbows, correct? Mm-mm. Okay. Alright, so that concludes your GI system, which would be your belly and your intestines and everything. Everything looks great to me, but I'll report any findings to the doctor or nurse practitioner. And also, we checked your musculoskeletal. You have full range of motion and no limited mobility. So I think everything looks good. Do you have any questions for me?
No.
Okay. Thank you. Have a good day.
Mm-hmm.